Okay, I think we'll go ahead and just get started now. Apologize for any background noise. We're still at the clinic, still treating. So you might hear some of them in the background, but we're gonna get started. My name is Tyler Uttech. I'm a physical therapist here at the Lincoln Park location for React Physical Therapy. We're right by the Red Line North and Clybourne station, or the Apple Store area, just off Halsted. Just give me an idea where we're treating right now. I'm going to go ahead and share my screen. We're going to talk about some knee pain today. I'll let you know now that these aren't like extensively detailed slides. I don't think that's, I don't like that kind of presentation. I much more enjoy a lecture purposely. I like points to help guide, but just kind of giving you a heads up. So again, my name's Tyler, and we're going to talk about some knee pain. So I figure we'll start with some just basic anatomy. We won't get too into the weeds on it, but your knee has two different joints that articulate. You have your tibial femoral, so the tibia bone, that shin bone articulating with your femur, as well as the patella and the femur joint. So these two bones articulate, and then these two bones articulate with one another. And as you can see, you have lots of different soft tissue structures. So you have the articular cartilage lining both ends of the bones, including on the back side of the patella. You have your meniscus that are laying right on top of the tibia. You have your ACL and PCL, your LCL and MCL, all of these different tissues, soft tissue structures help bring support to that knee. And then your overlying musculature, which we'll get into a little more detail in a couple slides, but just kind of want to give some basic anatomy on what might be going on with the knee. If you have any questions at all as well, go ahead and leave them in the chat. If it's very urgent, try raising your hand. I'm not sure if I can see it right now. I actually can't see anything besides my slides and me kind of in this top corner, but I'll go through any questions that you guys have in the chat at the very end. So kind of some biomechanics of the knee. Basically, what does it do? You have your standard, the flexion, the ability for that knee to bend, as well as extend that knee to straight. A lot of people don't know that your knee also rotates, and rotation of the knee is super crucial for absorbing impacts and actually having what we call optimal gait pattern. That rotation of the knee is controlled by your hamstrings. So think of the inside of your thigh and the back side. Those hamstrings cause a medial or towards the midline rotation, and the outside back side of the thigh hamstrings control the rotation outward or external rotation. And there's numbers here of 140 degrees of flexion, or 5 to -10 beyond 0. These are just like kind of what we see in the general population. I don't want you to think if you don't have 140 degrees, like something's wrong. Your body's adapted to whatever you've put it through. And so you might not have 140 degrees of flexion if you don't need it, if your body's not gonna adapt to something unless it needs to. So just kind of giving, again, some basic overview of some biomechanics. And we're gonna go on to talk about muscles. So a lot of muscles that go on in that thigh, really cool stuff. So you got what we call the quadricep muscles, vastus lateralis, vastus medialis, that rectus femoris coming across the top, and then underneath that is another one called the vastus intermedialis. Basically, just think of the vastus muscle in the middle. Those work to extend that leg we talked about. You got more with the sartorius, the gracilis, both of which attach just below the knee joint on the inside. It's a place called the pes anserine. Unfortunately, I don't think I have a good, we kind of do. So it'd be like kind of over here, basically. That's where those muscles will go on to insert. So coming back over here, your TFL, the IT band that also comes down, attaches on the outside of that knee. Here's those hamstrings we were talking about, those outside muscles, the bicep femoris group. That's responsible for that external rotation as well as flexing the knee. And then you have the semitendinosus and membranosus that come down and insert on the inside here, which is responsible for the medial, or the toes rotating inward. Your gastroc also crosses the knee joint. Not only does it help you stand on your tippy toes, but it actually helps to have a little bit of a knee flexion or knee bending moment. It's not as strong as your hamstrings, but it's important to note that it does play along with it. And then you have the plantaris, which is a muscle that's responsible for what we call unlocking the knee. Unlocking the knee, meaning that when your knee is straight, you actually have no ability to rotate that knee. And the plantaris helps to cause a little bit of a rotation moment to actually start to bend that knee. When this one is acting up, it actually causes some issues just with like that first little bit of bending of that knee. So again, just a very broad overview of everything going on with the knee. So let's go ahead and go and talk about some conditions. Now, if you're in pain, the one thing I don't want you to do is like see these symptoms and be like, I have that. There's no guarantee on that. You'll notice that a lot of these have similar symptoms. And that's where it's important to go see a physical therapist and get yourself assessed to have a proper diagnosis. So we're going to talk about patellofemoral pain syndrome. So this is one of those conditions where that patella is not gliding as well along that femur as it should. Kind of bumps around a little bit and you get a little irritated. It's very common in runners. That's why it's got the nickname runner's knee. A lot of times people describe it as pain on the front side. It can be kind of traveling everywhere. That's the thing. And it's usually, there's a lot of different factors that go into it. Whether that be overloading the muscle and the soft tissue, could be part of this quadriceps tendon or the patellar ligament that's getting overloaded. Not being able to cause a good pull on the patella that ends up causing that bumping into an irritation. It could be you have a little too much internal rotation of the knee that's causing this patella not to track well in the groove. These are those little specifics that it really helps to have a physical therapist there to talk with you and assess you properly. I just want to go over some of the symptoms that people typically describe the pain. So like ascending and descending stairs, sitting longer periods with your knees bent, kneeling down on surfaces, or just like think of a lunge. You're not even quite on the ground yet, but you might experience some pain, or squatting. So just kind of, again, big overview of this condition. We're going forward with knee osteoarthritis. It's considered a degenerative joint disease. We kind of describe it as wear and tear because we don't have a lot of good research as to why it happens. And so that's why the primary cause, it's named for primary or secondary, meaning primary, it's just kind of happening. Osteoarthritis is degenerating inside the joint. That articular cartilage is degenerating, and what's underneath that articular cartilage is really just bone. And now you have bone on bone rubbing against each other, and that's causing that irritation in the area. So that's what the primary category is involved with. We just don't really have a good reason other than a wear and tear as a descriptor. Secondary talks about when we know there's a cause. So whether that be some type of condition they have that's putting extra force into the knee. So a lot of people who, obese people, they have a lot of extra force that are going into those knees with each impact of walking or running, etc. And that can really speed up that degeneration process. So when we talk about symptoms, again, we have pain upon movement. Sounds kind of similar to the patellofemoral one, right? You're just kind of moving, whether it be squatting, whether it be sitting for long periods of time, you still experience that pain. Again, just because your symptoms, it sounds like your symptoms doesn't mean I want you to go diagnose yourself. Some of the other symptoms that go with it, early morning stiffness. This is one of those conditions that seems to do a little bit better as you start moving around a little bit. And the reasoning why is because although we have that degeneration in there, we have some this fluid called synovial fluid that helps bring nutrients into the area. How we improve this is by moving around, and it flushes waste out of the synovial fluid and brings in more nutrients, just regular motion. And so that will help alleviate some of that irritation. Actually, you'll see that people who have this, you're like, it's really stiff in the morning and kind of hurts. And once I start moving along a little bit, like I start to feel better. I'm like, okay, that makes sense. Decreased ROM. You'll notice with joint conditions specifically, they'll have a drop in range of motion as that joint deteriorates further. And that's just really because those surfaces aren't able to move well with one another anymore. So it almost like blocks itself, it doesn't allow it to move as much. Again, we got prolonged sitting or resting. That's that. Sitting around never really helps conditions. It's great for very acute injuries, rest a little bit, but more chronic conditions like this tend to do better with motion. Joint line pain is something more for, clinicians to know, is that, you can kind of feel like a little space between your femur and your tibia, and just like a little narrow line. And that's just kind of what we call the joint space line. The area, it's the space between one bone and the other bone that we can kind of palpate. And usually it's tender there because we're pushing on it, and there's that's putting extra pressure into that capsule, the joint capsule. And you're just kind of palpating the irritation essentially. And what you notice as well is swelling in the region. So again, general overview of knee osteoarthritis. And now meniscal pathology. Oh, I forgot to add a picture. And so with these, usually we have traumatic events or degenerative instances of meniscal pathology. Your traumatic ones are where you see in like football or soccer or something. So it makes a quick turn and just drops to the ground immediately. And a lot of times they end up with some type of damage to the meniscus, whether it be something that needs to be surgically operated on, or they can manage conservatively, is something we decide later. But those quick twist movements are often what causes meniscal damage. Or you have degenerative, where we're talking over a longer period of time, tons of quick turns, or like if you think about stepping off curbs repeatedly at an angle while turning, etc. Over time, those can kind of like pluck at your meniscus. Think about that. Kind of give a little nudge here and there, and that accumulation over time is what ends up to be bothersome. One of the big symptoms that I've seen is this locking or clicking sensation that people describe. That is because if you look at these little tears in the meniscus, when the bones are articulating on that surface, they almost get caught just inside of that little cusp there. Sometimes there's other types of tears as well, where they like fold over, or stuff like that, where you can get these like catching sensations. And that's usually indicative of a meniscal pathology of some sort. Again, we have pain on the inside or outside of the knee, and pain with squatting and kneeling. Sounds similar to the other ones, right? So it's, again, I want you to think, like, if I have these symptoms, doesn't mean I have this going on or this going on. It could be many things. Human body's complex. It's cool for that reason, but it's complex. So I just want to go over some exercise that I think would be beneficial for everybody really to do. And so I'm going to go to these slides. Unfortunately, I did not figure out how to use Microsoft Office and put a video in there. I can do it on Google Slides, but not here. So the first one we're going to talk about is the quad release. So staples of React is our releases. And here we have our founder, David Reevy. He's going through the quad release. I muted the video because I'd rather talk over it right now, just to kind of give like a live response to it. But you can see here, he's got the foam roller under what we call the proximal thigh. Just think about closer to your groin, essentially, up higher up. You place some pressure over that area, and then you take that joint through some motion. What you're doing is lengthening and shortening that quadricep muscle and just applying some pressure over it. And you can go a little bit lower down if you'd like, closer to the knee. I usually tell people, play around with it, find those spots that you feel like a lot of tension, like you first lay on there, like, ooh, oh God, that's tender. And then just start taking through some range of motion. So this is our quad release. I usually tell people a minute each tender spot. Try to do like 2 minutes roughly. Yeah, you can see he moved up a little bit, and now he's a little bit more what we call distal or further down the thigh, but same idea. So second one is the hamstring release. It's the same principle, it's just a different set of musculature. So you can see she has a lacrosse ball in her hand. She's going to place it underneath the back side of her thigh. Now you have your inside thigh muscles, that's semimembranosus and tendinosus, or the outside ones, the bicep femoris. Again, same idea. Play around with it. Place that ball underneath. It's the same motion. You're kicking up and letting that knee bend back in. Same idea. You apply some pressure over that muscle belly, lengthening and shortening. I think both of these are really great to do before activities, sometimes even after, depending. Oh, that was shorter than I was expecting. Sometimes even after activity for like a recovery. You can kind of pick and choose. You can do both. I'd say play around with it. It's the same idea again. 1 minute each tender spot, and usually hang out about 2 minutes in total for each leg. So now we're going to some other ones I think are good for strengthening and mobility purposes. So we have this isometric knee extension, the Swiss ball. That's basically a big, long phrase for I want you to kick this ball into a wall. So the thing I like about this is you can change the angle. As you can see here, he's kicking in with a 90-degree knee bend. That's awesome. Oh, now you can change it up to 60 degrees. And that's where you can play around with it to where 45, 30, you kind of have to be a little more creative around an at-home setup, but all you need is a chair and a ball, and you can work on strengthening these quadriceps in the lengthened position. And so with that principle, if you're going for max strength, I want you to do shorter time limits, but higher intensity. Really think about like what you can do 70% intensity, like a 70% max, 80%, 90, all out. Or if you want to go for more endurance, you're a runner and you need to be able to handle longer duration loads, then bump up that time from 10 seconds to 30 seconds, 45, a minute, but lower the intensity down to like 50, 60% max, okay? So this is one I really like to add in with people. I think it's just an easy one to do at home as well. The last one I like to do is some knee CARs. CAR stands for controlled articulating rotations. And it's basically a big acronym for your joint's full range of motion. So with the knee, we can see here, she's going to have him straighten the leg while also bringing those toes to the outside. See, rotates outward and then begins to start to bend that knee back down. And then on the way up, you bring the toes back across, medial rotation, and straighten back up. I always tell people it's like kind of drawing like a big circle in a way. But you're basically combining the knee bending and straightening with a little bit of rotation as well. And I included the links to these videos below for people watching the recording. For people live, if you look up quad release, react, hamstring release, react, isometric knee extension, the Swiss ball, knee CARs on YouTube, they'll come up. Or if you wait till the recording after, you can pause on these screens and take this. So these are like the four I tell people, like I could throw these into anyone's program for the most part, and they'll probably be helpful in some way. So I'd say try these at home, throw them into your regular regimen and see how you feel afterwards. The last thing I wanted to go through was just some final thoughts because so if you're in pain, go get assessed. That's the reality. There's too many times I've seen on TikTok, on YouTube, on Instagram, it's like, oh, you have this pain, try this, and that might work for you, but there's too many different causes of pain, and we need to be able to address it with a more holistic approach. So I always tell people, just because you have some of the symptoms that we mentioned earlier does not mean you have that condition. Does not mean that these 4 exercises are going to help you. I think it's just better to go and get assessed by somebody. And with that being said, React does free screens. We have locations in the West Loop. We have locations in Wilmette, Deerfield, Lincoln Park, and Lakeshore East. We do a 15-minute free screen, which is a great way for us to kind of get a general idea of what's going on. And if it's deemed that you could really benefit from some physical therapy, then I think it would really help with the actual evaluation afterwards, because we kind of already have a good idea of what's going on. So again, I want to go over where we're kind of at. So you can see here, we have that North and Clybourne red line, the Apple Lincoln store. This is Halstead. One street over is Dayton, and that's where we're at right here. You really can't miss us because we have these ginormous orange walls. It's really hard to miss us. And Scott and I are the physical therapists there. So come on in. You can also just go to our website and click on our pictures, and you can actually, I think, schedule from here. If I'm not mistaken. Oh, maybe I'm wrong. I don't know. Well, worst comes to worst, give us a call. We'll take care. Oh, wait, just kidding. It's right here. Book now. Sweet. I'm glad I figured that out. So from here, you can just make an appointment with us, either one of us, and we can do our best to get you back to doing what you love. Again, these exercises are not meant to fix things. They're just meant to kind of improve what's already going on. But if you have pain, go get assessed. I've already covered the React physical therapy location. So again, Wilmette, Deerfield, the West Loop, Lakeshore East, and Lincoln Park are where we're located. And at this time, I'm going to open the door for you guys to ask any questions. So let me come back in here. So I see no questions in the chat right now. If anybody has any, feel free to throw them down there. I'm going to hang out a little bit longer, just for anyone that wants to ask something. I think you can actually message me personally too, if you wanted to remain anonymous. But that's kind of the presentation I have for you guys. This recording is going to go up on the website, I think, not immediately after, because it takes some time to render. Mark, you raised a hand. Can I unmute you in any way or something like that? Oh, I can allow you to talk. That's pretty rad. Sweet. Do you know how to unmute?
Hey, man. Yeah. Thanks so much. This is a great presentation.
Oh, hey there. Sorry, what's that?
I was just saying, thanks, man. It's a great presentation to start off with. I just wanted to say that at first and foremost.
Thank you. Appreciate that.
And it looks like the chat is muted or disabled. So, but this works fine. Those slides were great. Is that something that attendees could take a look at after the presentation?
Yeah, totally. I'm gonna send it over to Ashley, the lady who's like kind of in charge with the marketing aspect, and see if we can't upload it with it. Otherwise, we can always send an email out afterwards with the PowerPoint attached.
All right, awesome.
Yeah, thank you. Anybody else? We have a couple more minutes here, but again, this is probably going to be the end of it. Thank you all for tuning in. I really appreciate it. If you have any questions, again, you can check the website. I think my email is on there as well. If you have any, just feel free to reach out there. It'd just be my first initial T, last name Uttech, UTTECH at breact.com. Or feel free to give us a call to try and come in and get a free screen. But again, thank you, everybody. I really appreciate it. And yeah, I think that's it. Ooh. See who's left in here.